Welcome to the Healthy Hustling Podcast. I have today with me, I have Nate Baar. He is the CEO of HealthBar. I am super excited to talk about this. He started HealthBar really from the ground up. We're going to talk about his journey and really how this is going to impact you. So whether you are a business owner who is looking to improve the health of yourself and your employees, you're looking at costs, we're going to talk a little bit about that. Or even if you're simply just someone that's looking to improve their overall health and you're sick of the traditional model and what that looks like, we're going to be talking about all of that. So the best way to optimize your health in the world that we're living in right now, and I think we can all agree that the traditional system, it's broken, it does not work, and we're going to talk about how HealthBar has really been leading the way, and really we have a very similar model between HealthBar and Fuel Health and Wellness here in Grand Rapids. So thank you so much for coming on, Nate.
Yeah.
Did I miss anything? Tell us a little bit about your background?
No, you hit it well, Eric. Excited to be here. And I think the conversation we're going to have today is going to speak to a lot of people. There are individuals that maybe need more healthcare than others, but when we look at healthcare, we're looking at the primary and preventative care side of things. And that's applicable to everybody. And it's something that we're very passionate about. But it's also looking at healthcare differently. Everybody looks at traditional healthcare and says, when I think about going to my doctor or having interaction with my provider, you're thinking about it being sickness related, but not health related. And we really want to change that stigma that's associated with primary care and preventative care, and say there's a traditional way of looking at this, but how do we augment that into a non-traditional approach that blends this preventative, who'd say Eastern medicine approach. So it's applicable to, I think, everybody listening today. And this is not just for unhealthy people. I think healthy people listening to this need this just as much, because we all have opportunity to get better.
I would 100% agree with that. My goal is to always improve 1% every day, is to get better. So what made you want to approach health in this way? I guess, can you tell us a story on how you thought, man, we got to fix things, and what led you down that path?
Yeah, it's interesting when you get into the clinical world. You get your education through one of the collegiate institutions.
And what's your background, just so people know?
Yeah, no, good. Registered nurse. Graduated with my bachelor's in nursing, and then I've gotten my master's in healthcare administration. So have experience at the bedside, providing care, mainly in emergency departments, was my early clinical career. And then also have experience on the administrative side of healthcare. So how is healthcare financed? What's the legal frameworks behind our healthcare strategies? What's the business model of healthcare? I've been privy to all of that information, and that's really changed and created a lot of my thoughts and strategies to what we're doing today. So.
Yeah. So what made you want to change the system?
Yeah, those experiences. So when you go to college, you're taught a certain way of practicing healthcare. You're taught skills. You're taught different clinical strategies, pharmaceuticals, physiology, these different things. But they never talk to you about nutrition or exercise physiology or preventative care. It's always, people call it the sexy side of procedures and these cool things that you do. But nobody wanted to talk about preventing all the sickness. And so you get in there and you're somewhat brainwashed, I think, by these institutions. You're really pigeonholed into a way of thinking. And then you get out of that clinical world and you go, or out of the school world, you get into the clinical world, and it's reinforced there times 10. Mm-hmm. And so somebody came to me in the emergency departments and, viral illness, whether it was, maybe an orthopedic injury, something else, it was always about intervention. So what do we do? What are our tools in our toolbox?
And intervention for that was, I'm guessing,
Pharmaceuticals, procedures. It was all about, you'd come to somebody with chronic back pain, right? And you think about all the reasons why somebody may have this pain. What's the core reason to this? But because that patient coming through our doors was a revenue sign to us from the administrative world, we would always say, how fast can we get these patients in and out? So in the ER, we would talk about, people would say treat and street, right? So I get somebody in a bed, how quickly can I get a radiology image of their back? how quickly can I prescribe something for their pain, and then how quickly can I get them out the door. We aren't doing anything good for these patients and really trying to fix the core problems of why they have this pain. What we're trying to do is do what's necessary to cover ourselves legally and then get them out the door and hopefully not have them return in a period of time. So when you break it all down, it seems terrible when you think about it. It's something that got me so frustrated about the healthcare system is we're not solving any of these issues, right? All we're doing is putting band-aids on a lot of these things, sending people out the door and hoping that they have the tools to fix themselves, but we're not guiding them through or providing them the adequate amount of care that they need to do that. So it was all of that kind of stuff, and then seeing the business side of healthcare that really created this not hatred, but strong dissatisfaction with the current system, and then started thinking about how do we get more proactive with these strategies? How do we actually start fixing this problem?
And so you talked a little bit about the ER side of things. Let's talk a little bit about the primary care, because I know that's where HealthBar is going. So HealthBar, give us a little bit of, I guess, before we get into that, what is the background? What does HealthBar do? What do you guys do?
Yeah, we focus mainly on the primary preventative care side of the healthcare sphere. So think, and we get into some acute injury illness as well, but really think urgent care and below scope of practice.
Okay.
So individuals come to us with, maybe viral illnesses, maybe they're feeling sick or whatever else, and we have strategies for treating them. People come to us a lot of times trying to establish healthy habits. So how do I quit smoking? How do I improve this health goal that I have, losing weight? Maybe it's something with mental health. So we're available to these individuals for this broad scope. We access and care for those individuals via relationships with businesses and schools. And so looking at providing this primary preventative care scope of service to these populations, and then in turn, that care and in the insurance models that we work under provides a return on investment for that organization. So that's our main sphere. We don't provide emergent treatments. If there's something that we provide that goes beyond our scope, we navigate then to the highest quality, lowest cost providers.
Yeah.
So
So we talked a little bit about what's broken in the ER. Would you say primary care, is it similar? Is it different as far as what's broken or outdated in the traditional model? Is it treat and street, like you said, or is there anything different to that?
Yeah, primary care, there's actually a recent study done about a year ago that surveyed primary care actually around the world. This wasn't just a US thing, this was around the world, and found that a large majority of primary care providers are very dissatisfied with the work that they're doing. They're dissatisfied with their compensation related to the work that they're doing. They want to spend more time with their patients, but they can't. And all of these reasons, all these dissatisfaction points that these providers have are really centered around some very basic things that the system could fix. But what's happening is you have fewer and fewer primary care providers, more and more sick patients needing care. And so primary care ratios right now are somewhere around 2,000, 2,500 patients to one provider, which is
Holy
impossible.
cow.
Yeah, if you just thought about if you scheduled every single patient for their annual physical and you tried to do that during your working hours and not fit in anything else, right? No other needs of that patient. Your schedule would be full. And so there's really no time. And that's one of the biggest things is time for these providers. They can't establish that relationship anymore. They can't understand their patients. And this isn't for, I think a lot of times when we talk, it sounds like we're demonizing healthcare. And it's, there's the providers and the practitioners within that world are just trying to survive and do their best. It's the system that's messed up. And so whether it's productivity metrics or certain outcomes that are being pushed based on system goals, these providers are now employed by these healthcare institutions being told what to do, which is causing a ton of moral fatigue and dissatisfaction.
And it sounds like a lot of this is all related to the payer model, right? As far as how a lot of it, insurance can dictate care, right? As far as reimbursement and everything like that. And I know from a physical therapy standpoint, right, we just got, for example, Blue Cross Blue Shield just cut reimbursement for physical therapy by 17%. That's going to wipe out some businesses. They're going to be gone. Medicare has had their cuts. They just cut again. And that's not just physical therapy. I think that's happening around the with all the different, as far as medical model goes. But So the traditional mindset I know for physical therapy has been get them in as quick as you can, treat as many patients as you can, right? And then get them out the door, and then cross your fingers, hope they don't come back, right? But if they do get hurt again, hey, come right back. And so I know there are certain providers too where it's like you have the whole authorization things, and a lot of times they authorize like one visit, and then might authorize 3 visits, and it's like they're dictating how these people are being seen. And going back to the person with chronic back pain, is that actually what's best for them? Probably not. And yeah, it's just it is really catching up to us, and we're seeing this too from the just health perspective and outcomes, and what we're getting. People are getting sicker and fatter. That's just the reality of it.
Yeah, and if you look at it, I mean, everybody's thinking about the short-term gain in business models of healthcare. So the fee-for-service model you talk about, right? How many visits can I get? Not looking at like what does it take for this patient to get healthy? What do they actually need? And looking at the resource allocation kind of in reverse. And that's where in our HealthBar conversations we really try to talk about is that if we can, it's taking that value-based care model, attributing a dollar amount to a certain amount of work that's being done, and then providing an unlimited amount of care within that payment approach, which puts then a lot of the onus on the provider. And there are downsides, that you could call out within this model, but in general, what you can do is fix costs, but then also allow for nearly unlimited access by your patients, which then changes that thinking of, well, what does my patient need now? Because I have to work within this, and then what's going to provide the best outcome for them. And so it puts pressure on the practitioner, but given time and the appropriate amount of resources and other access points, it's way better for the patient in that situation.
When you say it puts pressure on the practitioner, though, you previously said that these practitioners and providers, they're getting burnt out, and they're treating too many people. And from what I'm hearing now, it's the pressure is to get results. Is that what the pressure is?
Outcomes-based care, right? So we're trying to achieve an outcome with the care provided. And so instead of the pressure to see more patients, it's to provide very high quality care to produce better outcomes. And so it's changing the incentive model where, yes, if I'm a provider in a hospital system, I need to hit a certain amount of RVUs to make to hit my goals, to make my performance metrics look good, to hit my bonuses, to do all these things. But if the value that I'm providing as a provider wasn't to see more patients, but to produce better outcomes, the mental model shifts quite a bit. So then I start thinking about that interaction with that patient. I'm asking different questions, and I'm recommending different treatments versus this revenue-based model, fee-for-service model. So there's always pressure as a provider, as you feel it as well.
Oh, yeah.
We're dealing with people, right? So there's always that pressure of doing the right thing and wanting to see good outcomes for individuals, just like what tools and what system are you working within to produce that. And that's why I think, when I talk about healthcare and maybe some of these negative ways, it's the business of healthcare, because it's the model that we're working within that's producing these bad outcomes. It's not the providers themselves.
Yeah. So your vision is to take things from a reactive approach to a more proactive approach when it comes to healthcare, and having a more outcomes-based outcomes-based business in providing healthcare.
Yes.
Which they talk about that all the time, I feel like, right? As far as like changing even the traditional model of we need to have more outcomes-based. Do you feel like that's actually being done?
What drives me insane. So I'll go to all these conferences and I'll hear all these buzzwords, and people in the healthcare industry will talk about value-based care, and they'll talk about outcomes-based care, and they'll talk about all of these things because I think everybody acknowledges it's the right thing to do. People want to see this happen. But then they say that and they immediately go back and they continue to work in a exactly opposite system. And so I'll hear this, and it's always with a grain of salt in my head. It's like, that's the right thing to say, and you're saying it up there on stage, but you're not actually doing it in your business model. And so that's where in part of the work that we're doing, it does have to shift. But one of the bigger changes that has to occur is the financing model, that insurance pay model that's built off of a fee-for-service approach. And to truly achieve value-based care, you have to shift to an outcomes-based and or a capitated payment, singular payment for all this care approach. And that then puts the pressure on the provider to provide the good care. Um, but but yeah, healthcare says it, and I don't think they really understand how to do it. It's also funny when they asked a bunch of providers, like, what does value-based care mean to you? Nobody answered it correctly because they talked about it, but they didn't have any clue on what it actually was.
Interesting.
So, yeah.
Interesting. So what does value-based care mean to you?
It's really looking at the patient's outcome. And so if we're looking at care being provided, it's getting away from the fee-for-service payer model, not as I do more as a provider, the more I get paid and reimbursed, getting away from that idea and saying, I am going to fix my revenue and or put risk on my provider side on patient's outcome. So how do I align outcome with payments and or care of this individual underneath a singular payment model? And so that's where I think value-based care comes into play. I could do all this testing, I could do all of these treatments, I'm not going to get paid any more money.
Yeah.
And so it forces me to say, what is going to produce the best outcome within this fixed amount of resources?
Primary care model that you're talking about, who belongs on the primary care team? What should people be looking for and doing? Should they be ordering certain labs, annual physical? Should they be doing a physical more than just annual? What does that really look like to you for the consumer, the person receiving healthcare, right? What should we be doing?
Yeah, primary care should be your first point of contact, right? It's that practitioner who's overseeing your medical care, who knows you as an individual, who has a relationship with you. And then you start tying in, we would say some of those ancillary services or supports. The traditional model says primary care is just a funnel, right? So you go to your primary care doc and then they order all these tests. They say, hey, go here, I'm going to refer you to this or that, whatever else. But they're leaving out, I think, one of the core parts of a true primary preventative care recipe, which would be, how are you bringing in nutrition? How are you bringing in physical therapy, chiropractic care, massage therapy, any of these other things that are seen as tools to use only after something bad has happened, not preventative tools that you should be doing on a certain cadence to keep your health good or improve your health. And so a lot of people just look at primary care and they think of your general practitioner that you have a relationship with, that you see once a year for your annual physical. But I believe what a really good primary preventative care team looks like incorporates nutritionists, exercise professionals, people who are doing adjustments to your body or helping you get stronger. All of that stuff is super important.
I would agree with that. I think really the primary care model should look at, hey, who is this individual in front of me and what are their goals? So I've got an athlete in front of me. What are they doing from a nutrition standpoint? Are they talking with a mental health counselor? What labs have been drawn, right? Like blending all of it in together to really get the best outcome, because we know if they are stronger, if they're eating healthy in the right way, I mean, it's going to show up in their labs and their blood work typically. Right. And then they're going to live longer, healthier lives. I think you're just going to see people be less sick. And while I used athletes right there as an example, like it could be like my grandma, right? Like going in and my grandma wants to be able to garden. Does she have the range of motion to get down and do gardening or something like that? So being on top of it and doing those screens, and I think it does take a whole team of PTs, NPs, dietitians, mental health, all of that.
Yeah, we if you go back to some of my comments on how we were trained and brought up within the healthcare system from a higher education to those clinical experiences, we're not trained on the provider side to have extensive knowledge in those areas. And so a lot of things we aren't familiar with, we stay away from, or providers have put themselves on this pedestal saying we're the most important part of someone's health journey. And honestly, good providers are really good at assessing and screening and identifying and then recommending treatment. But the actual provision of a lot of these things are done by alternative professionals, and we just have not looked to these other sources of health optimization in that primary care world. And I think it's something that it's not advantageous for a healthcare system or a hospital system to bring them in, because technically a healthy patient is less revenue for a hospital. And so as bad as that sounds, there is an element of truth to that on how healthcare institutions think. And I think if you just go back and and look at, they say these things, but always judge someone by their actions. And so look at our current healthcare systems and say, what are they doing to achieve these goals that they say they want to achieve? And that's where I think the truth comes out.
So what does success look like in a preventative first model? Is it like, so we've talked business, right? Is it business, or is it longevity? Is it obesity rates? How do we measure success?
Yeah, we look at, if you look at utilization rates of a lot of healthcare services across, across populations, you could use really objective measures like that to say what's the ER use, what is the some of these more intervention-based usage statistics to see if there's success being done. For me, as I see it, I think success with this looks like healthier people living lives that they want to live, using less acute and emergent care, needing fewer procedures, and honestly being empowered to take care of their own health. We have created really this dependency model in healthcare where it's, you can't do any of this yourself. You have to come to me to do this as a provider. And it's so limiting for a patient because I think people want to do better for themselves, but they don't have the knowledge, the expertise, or the permission to do it. And I want people to feel empowered in this primary care model, to know through education, through techniques, through things they can do in their own home environments on how they improve their health, being guided by us as professionals.
Yeah, I think a big part of measuring it in my mind too is like a decrease in emergency room visits, ER visits. From a physical therapy standpoint, I look at it like, are we saving people from surgery, right? Are, for example, ACL injury rates, are they going down? Are we making an impact on those? That I think is a way to really, the best way to measure that. And again, make sure that people are taking ownership in their health and being proactive versus reactive, and that we're actually getting outcomes. How do we get traditional healthcare to buy in? Like, there's a lot of barriers there. Is it politics? Is it policy? Is it going to, is it insurance? I know that's probably a loaded question.
Yeah. I'm going to be pretty skeptical on this one because I don't know if traditional healthcare can buy in, to be quite honest. It's one of those things, based on my personal experience, trying to affect some of this change internal to the healthcare system, and having that, be the genesis of the creation of HealthBar for me. I don't know if there's enough critical mass within our healthcare system to do this themselves. A lot of this work is anti-business model of our traditional system. It's anti-consolidation. It's supposed to reduce costs, reduce utilization. And so I think there are many things that a healthcare system would say, these are the same goals we have, but if you put their feet to the fire and actually made them invest and put dollars into these things, it would show, I think, their true colors. And so my take on traditional healthcare adopting these models is that I think pressure has to be applied from the outside, and they have to be forced to change based on changing the industry from creative and innovative efforts.
Yeah, I would agree. I think a good place too, I think with what you guys are doing with going directly to employers and having people's employers, because a lot of people are like, oh, my employer pays for my healthcare, right? And going to them, I think, is a really good way to get boots on the ground and get things changing, and having this little bit of a grassroots effort. So with this has been super insightful, and I think we could stay on this stuff for hours, but like, if someone wants to talk to you and learn more about HealthBar and maybe how HealthBar can help them, like, who is your perfect niche? Who should be talking to you? Who do you guys specialize in?
Yeah, right now we work with businesses and school districts. Businesses, mid to larger size, 200 to 1,000 employees. Usually our program works fantastic with them. We can work with any company of any size, and we would definitely love to have the opportunity for the conversation. And then K through 12 school districts, we talk about providing healthcare to adults a lot, but we think it's super important to provide prime preventative care to students, K through 12 as well.
And what, I'm sure, so we've talked before about cost savings. What are these businesses usually saving in costs?
So a lot of our organizations that we're caring for, as we're doing that care, there's that, each visit that we're doing is underneath that capitated payment model. So instead of going to your doctor's office and spending $200, $300, $400 for that visit, a person comes to us and sees us, and that's for essentially $0 for that individual. So as we do more of our care, you can see as that volume builds, the ROI is exponential as we're not billing insurance for what we're doing. So a lot fewer claims off their books. We find that self-funded business insurance models work very well for our program, not limiting, but yeah, so we typically see, 2 to 1, 3 to 1 ROI for an organization based on what they're paying us to what the value we're producing. It's significant. A lot of people don't understand that the goal of having health insurance is to not use it. Health insurance isn't a coupon, right? Like I have home insurance for more catastrophic risk and other things. Same with car insurance, but health insurance we look at and we say, oh, I get to go to the doctor and get a discount. Like it's not a coupon, right? So we need to reframe our way of thinking about health insurance in general, and trying to find ways to use it more for catastrophic style, bigger ticket items, and think about using more of this cash-based model for outpatient healthcare.
And what's the best way for people to get a hold of you and ask questions if they're interested, in this? How can they get a hold of you?
Yeah, I'm very active on LinkedIn. I'm not shy with my opinions on the healthcare system, talking more about the topics we talked about today as well as others. So follow me on LinkedIn is a great way to get introduced to some of the ways we work with the healthcare systems. But our website, healthbar.com, we have amazing individuals.
We'll post this in the description.
Yes.
So if you're listening, there would be a link to Nate's LinkedIn profile as well as HealthBar's website. Any other best ways to get a hold of you?
Yeah, that's basically it right now. We, what we would say is there's different stages to becoming aware of this style solution. Many people don't understand how this works in general. So just having a conversation just to understand more about this business model and way of receiving healthcare. We're very happy to have that. Or you may be evaluating something like this for your organization and you want to think about implementing services. Very happy to have those conversations too. So don't hesitate to reach out. If anything, I'm very passionate just about educating the industry and the market on these types of approaches and different ways of thinking about healthcare. So I love these conversations and I'm always down to have them.
So I will say one of the things that gives me hope for the future of healthcare is there are people like you out there actually going and making a difference. What gives you hope for the future of medicine and healthcare?
Yeah, I being an entrepreneur and going on these endeavors, if you look at it, they look impossible, but I think having hope is one of the biggest things for me. I have hope in people. I know people want better. They have this intrinsic desire to do good, and so I think as we continue to harness that motivation within each of us to be better, that gives me hope that we can achieve these goals.
Awesome. Well, thanks so much for coming on today, Nate, and this was an awesome conversation. We'll have to do it again. Thanks so much for watching. Please, if you have any comments, put in the comments below and share this with anyone that you know that is passionate about this primary prevention model and improving our healthcare. Thanks.
Thanks.